Before the option of laser eye surgery, the only way for treating vision problems was with eyeglasses or contact lenses. Treatments have come a long way, but how do you know if this is right for you? Dr. Jeffrey Gold is a board-certified and award-winning ophthalmologist who specializes in laser vision correction procedures. Doctor, it's nice to see you again. Welcome to the show.
Thank you for having me back.
So today we're talking about a newer form of LASIK surgery.
Well, actually, it's a newer version of the oldest form that we had.
Okay.
Originally, the FDA approved us back in the early 90s for PRK, and PRK involved no cutting.
Okay.
But it had a prolonged recovery period, a prolonged visual recovery, and was very painful. The next thing that happened around 1995 was they approved LASIK, and everybody jumped to LASIK, almost everybody.
Including yourself?
Including me, because the recovery period was non-existent. People had their vision back the next morning after just a good night's sleep. But over time, it became apparent that LASIK may not be so terribly safe. And I can show you with this model why that particularly happens. In LASIK, we cut the cornea, fold back what's called a flap, and then the laser correction is done deep in the third layer of the cornea. The flap goes back down, the edges seal overnight, but this is relatively new information. From here to here, in the bed of the cornea, never heals. We used to think it would heal 10, 15 years, but now we know it never heals.
Okay.
And that's the reason I don't do LASIK anymore. Because if a person has LASIK and 5, 10, 20 years later gets hit in the eye and that flap comes loose, if they can't find me in an hour to fix it, that eye's in big trouble and might need a corneal transplant.
So this new procedure is called Epi-LASIK.
It's called Epi-LASIK because all we do is take off the epithelium, and we have an image that compares LASIK to Epi-LASIK. LASIK is on the right, and you can see the flap folded back. Epi-LASIK is on the left, and you see there's no flap there. The procedure is safer because there's no cutting, safer in the long run because there's no risk of the flap being dislodged. It causes less dry eye. It causes a better quality of vision because all we have to do is get that epithelium to heal smooth, and that's a piece of cake. It's non-painful, and it's a wonderful procedure.
It seems like it would almost be easier than buying contacts every couple months.
Not just easier. In the long term, it's less expensive, and there's well-documented studies that show that over the long haul, there's a higher risk of infection in chronic contact lens wearers than there is with Epi-LASIK.
Let's put up our other picture. It shows that there really is no cutting or incision like you mentioned. You're just kind of separating?
That's right. You can see that white device is a blunt-tip plastic separator, and it just pushes off the epithelium much like a snowplow pushes the snow off your driveway. And that layer then, with the epithelium gone, I have exposed to me the second layer down where I do the laser vision correction, and then that layer grows back over the next 3 days.
So are there any pros to having the other form of LASIK, or do you think it's going to be obsolete?
Only the instant gratification.
Okay.
And that is that you wake up the next morning and your vision is typically back to where it's going to be. Whereas with Epi-LASIK, it's a slightly slower process. The vision is still a little bit blurry during those first 3 days, but people can function. They can work, they can drive, they can play.
Oh, if you could drive, it must not be too bad then.
Absolutely. And the only restriction that I put on my patients is no swimming for about a week.
Okay. Now, doctor, is this a permanent procedure?
It is. All of the laser vision correction procedures that have been available to us over the years create permanent vision change. Great.
All right, let's put the information up on the screen. If you want to learn more about Epi-LASIK, you could contact Dr. Gold at Liberty Vision. The phone number is 203-281-5745, and you could check out their website. It's libertyvision.net. Dr. Gold, that was very informative. Thank you so much for being here.
Thank you for having me.
All right, coming up next, we're in the kitchen. Cooking instructor Claudia Chewinski shares her recipe for orange stir-fried chicken. That's when we come back. Don't go anywhere.